It was at the end of a really busy day at work. Beth Scholson, who works on the eD-H team, knocked on my door and she said, Deb, I have this great opportunity. I want to know if you'd be interested in joining the eD-H team. I think you should think about applying for it. And literally, I looked around at all my piles of work and I said, wow, I don't know where I'm going to fit this in. And she said, no, it's instead of. So I said, all right, well, I don't know. And she said, just think about it. If you're going to build an electronic medical record for a company, you need clinical people as part of that team. If we're going to do this for live patients and we're going to take great care of people, we need to have that clinical component. And so to be able to be a nurse on that team to do that and to really do nursing informatics, I couldn't not do it. And I just felt like it was a 3-year opportunity. I should really take the leap because I would always regret it if I didn't. I joined the team. We went out to Epic and we learned the Epic product. We became certified. We came back as a team. We started putting the product together. And then we did that for about 2.5 years before we actually went live. So we went live on April 2nd of last year. I don't think anybody could have prepared any of us for what we were doing. It's extremely involved. You know that somehow you're going to take the electronic medical record you have today, which we had CIS, and you're going to transfer that over into a new record. But you really don't know all the ins and outs of that. I certainly didn't realize it would be quite as intensive as it's been. Some of the biggest challenges we faced with the implementation of eD-H was really the amount and the scope of what we were going to do. We were going to turn the switch in one day. And that meant that we had an enormous amount of people who were going to need our help. So I really think our challenges were more just based on the large amount of scope and did we have enough support to help everybody? There's no way we could do this by ourselves. So we knew that we needed people in departments to help us out. And we really started to work closely with them and to have them help us share the product with everybody in the clinical sector. We engaged a lot of people in a lot of departments. We got departments together instead of sort of saying, oh, you're from the Lebanon campus, oh, you're from the southern region, let's have something different. We said, hey, you know what, it's one record, our patients go across, our entire record should go across too. We then went out to our end users and started to say, hey, tell us what you do for a workflow because we have to make sure that your workflow matches the one that we're going to use in the new electronic system. So tell us what you do and let's see if we can sort of match that together. If you want an electronic medical record to work really well, you start to use local support staff or what we call super users. And what these folks are your key people in your department who hopefully have an interest in the electronic medical record, at least a little. And they too sort of just get it. Some people just, naturally understand computers. And so they get that system and they're able to take that back and share that with their department in a way that their department understands what's going on too, because they also understand their folks in the department. Today, when I work with a lot of the local support staff, what I'm seeing now more than anything is that they're really looking at how do I make my department as efficient as possible? So how do I take what we have in eD-H, look at some of the parts that we have, and figure out how to make my providers so that they can get through their day and not stay till 10 o'clock at night and do charting, but how can they actually get done it faster? And how can I get the nurses who are on the phones actually get through their job quicker? And so how do I make that system do everything that I need it to do? And how do I get my department to benefit from that? Twice a month, I have an eD-H support group that we do. And so it's a WebEx. And I currently have, I think, 177 people that are part of that. And they're from our southern region. So we have people from Nashua and all the surrounding communities. We have people from Manchester, the surrounding communities. We have people from Lebanon, the surrounding communities. And we talk about whatever the issues are that are going on. Is there a new bill that they need to know about so that they can take that back to their department and say, hey, this is what's coming and we think this is going to help. Or they might bring us an issue that they've been having and we realize that several people have this. And they say, oh, you know what would really work for us? And then I can take that back to my group and say, hey, you know what? They're really struggling with this. And we need to help them find a better way to do this. And it's really fun when you get to go back to the next meeting and say, remember what you suggested? We actually did that for you. So we've really been able to work closely with our local support staff in doing that and bringing that to the departments and then back to us so that we have that really two-way street. I still get to say, you know what, what's top priority? We have to look at the safety of our patients versus, oh, you know what, this is something that's nice to have, but from patient care standpoint, maybe that's not quite as important. I'm really engaged in working with our decision support tools, our best practice alerts, our reporting, and making sure that we have what we need to do our quality measures and our meaningful use. I don't get to help just my one patient or my 10 patients that I saw one-on-one each day. Now I get to help all these people, help all their patients. So I feel like I actually get to help more patients every day be healthier, which ultimately is my goal as a nurse. So yeah, I really do. I love what I do. And my team is the best team to work with. They're the best.